This is a demonstration of cervical lateral flexion. The therapist will first palpate and find the C7 vertebrae on the patient. Okay, and now they will line up the axis of the goniometer on the C7 vertebrae. The stationary arm is perpendicular to the floor, and the movable arm is lined up with the midline of the dorsal skull and occipital protuberance. Now we will instruct the patient to lean her head to the right with her nose forward and no head rotation. The measurement is 47 degrees to the right. Okay, and now we will instruct the patient to laterally flex her head to the left. And the reading is 34 degrees. This is a demonstration of cervical flexion and cervical extension. First, we will demonstrate cervical flexion. The axis of the goniometer is centered over the ear. The stationary arm is perpendicular to the floor, and the movable arm is in line with the nose. The patient should be sitting in an upright position, and the therapist will instruct the patient to bend their head down. The measurement is 43 degrees. Next, we will demonstrate cervical extension. Again, the axis is centered on the ear. The stationary arm is perpendicular to the floor. The movable arm is in line with the nose, and the patient should be sitting in an upright position. The therapist will instruct the patient to bend their head backwards. The measurement is 40 degrees. This is a demonstration of measuring rotation of the head. The axis of the goniometer is centered on the top of the head. The stationary arm is parallel to the imaginary line of acromion to the respective side. The movable arm is positioned at a 90-degree angle over the nose. Now the patient turns their head to the right. It measures 45 degrees. Now the therapist will swap the goniometer to the respective side for the left. The patient will turn their head to the left. The measurement is 40 degrees.
This is a demonstration of manual muscle testing of scapular retraction. First, the therapist will palpate the patient's medial border of their scapula. She will place one hand on the rhomboid muscles and have the patient retract the scapula. With her hand on the rhomboid muscles, she will use her other one and she will tell the patient to hold her position against resistance. She will apply resistance by trying to push them in the opposite way. This is a demonstration of manual muscle testing of scapular protraction. First, the therapist will locate the patient's medial border of the scapula and find the rhomboid muscles and place one hand on there. She will then have the patient protract her scapula. She will grab the humerus and tell the patient to hold their position against resistance. The therapist will use the humerus to try to push back and apply resistance.
Demonstration of manual muscle testing of scapular elevation. The therapist will feel for the trapezius and levator scapulae muscles and have the patient elevate or shrug the shoulders. The patient will be instructed to hold the position while the therapist applies a downward resistance. Demonstration of manual muscle testing of scapular depression. The therapist will feel for the trapezius and levator scapulae muscles. Have the patient depress the shoulders. The patient will be instructed to hold the position while the therapist grabs a hold of the humerus and applies an upward resistance.